Hey, hi everybody. Good evening. I think we're starting a bit late, but that's fine. So, for other people join us, we'll just carry on. So, I'll probably feel free to stop me at any time, ask questions, and I'll answer as we move along. So, I'll be getting a lot of questions, DMs, and all of that, and I really can't answer every question. So, I just decided to put this together to sort of go through most of the questions I get every day and hopefully take some questions from some people. So basically, I know a couple of persons are resuming this September health informatics. Some people have reached out, they're starting in January. So I think it sort of covers everything. It's just me trying to share what worked for me and how I got to where I am today. So just basically looking at the whole MSc informatics, how to navigate and getting your job after graduation. This is a brief outline of how we're going to go through this session quickly without wasting time. So basically myself, a little bit about myself. So I'm actually a medical doctor. A lot of people don't know that. So doctor, I currently work in the digital transformation space, more around implementation of electronic medical records and digital dictation systems. I finished my health informatics postgraduate degree in Swansea. That was 22, yeah, December 22. Then I've also got an MSc in clinical anatomy and my first degree from Madonna University. So over these years, I've worked around clinical care, ops management, QI, business analysis, project management, and I host a podcast behind the scenes with Dr. Ron where I talk about some of these things. So that's just a brief about me. Then just to look quickly about what's health informatics, and a lot of people ask that question all the time. So at the high level, I mean, this is not to go into the details of what health informatics is, but it's just around the activity of gathering, organizing, and analyzing healthcare data with IT platforms in order to support healthcare providers, that's doctors, nurses, to make informed decisions, improve patient care, improve efficiency, and all of that. So all of that is basically called health informatics. So in summary, you could just look at it as storage, retrieval, sharing, and use of healthcare information. Now, these four keywords, if you break it down, there are a lot of job roles that actually fall into all of these categories, as we'll get to see as we move along. Now, some people might ask why health informatics? Yet is relatively new, so it's still catching on ground because not a lot of schools actually offer the degree in health informatics. It's fast growing, the demand is there. There's an obvious skills shortage of persons who, have background or experience or knowledge in health informatics. It has the ability to, make a huge impact on healthcare service delivery, and it complements clinical care. So you can't separate the two together. So whatever you're doing in HI or health informatics actually complements clinical care, and there are actually loads of career opportunities across the broad spectrum of health informatics, as I'll probably discuss as we move further down the line. Then in terms of choosing the right program, I'll just quickly look at these things. So first of all, you want to research your university. So like I said, not a lot of schools actually offer health informatics as a postgraduate degree. So I remember when I was doing my research, I think I came across maybe like six schools in the UK that are actually offering health informatics, a few of them on site, a few of them online or remote. So there are very few offering those stuff. Then if you look at in the US, there are a couple of schools who offer that even at the PhD level. So you can actually go in for a PhD health informatics if you wish. But for me, I think I'll probably take a break after the MSc, really. So you want to research your university very well. You want to understand the curriculum. To be fair, when you look at all the schools offering health informatics, I think the modules are usually almost the same. If if you look at it in the granular details. But I think where they differ, it's where you have maybe the practical elements and all of that. So I know people complain that most of the schools are like theory based and all of that, but some actually give you some practical elements and all of that. I hope I'm correct. The University of West London, I'll probably check that later. So basically understand the curriculum, the spectrum of what you're going to be doing. But when you compare, it's almost the same thing. And I think for me, the part I probably want to pay more attention is the cost of your tuition, cost of your living costs. How much is it going to cost you? Do you have any scholarships available? What is the payment plan for your tuition? Do you have to pay everything at once? Can you break it into, three, four, five, six parts and all of that? You want to look at those ones critically, unless maybe you're funded from somewhere. Then I think cost is a very serious thing to consider. I remember I saw, I think, somewhere in Manchester and London, but again, I was now looking at the cost of living, and it was actually very, very high. I had to sort of look for other schools outside the London, Manchester area. Then you want to look at, is it online or on campus you're looking for? So a lot of persons, they want to come on campus. I mean, it's a different ballgame entirely, really. Or you just want to stay back where you are and do it online and get on with it. So you want to consider that. Then scholarships, are they available? So I know a good think during my time there was somebody who got a scholarship to study. So you want to check what available scholarships the university have. Then things like maybe Chevening, Commonwealth, if they also support programs like that. So you want to find out because that'll probably help you ease the cost of your studies, really. Then I know some universities also offer discounts on their tuition fees and all of that. So you want to check that out. And all of that information is on the university website. I think I have a video I talked about different schools that offer health informatics. I'll probably look for it and share it again, probably after this session or before the end of this session. Then lastly, and I think most importantly, is to speak to mentors, really, people who are in this space to understand what it is about. Because for you to cough out 20K to say you're going to study a degree, I think you must be pretty sure about what you're getting into. And I also did that. I spoke to a lot of persons, well, not a lot, a few people who were in the space, health informatics. I had a colleague who was doing a PhD in the US. I spoke with him, spoke to a couple of persons, and then I was okay, it really makes sense to get into it. So it's worth speaking to people, understanding what the scope is, what are the job opportunities, what are the pros and cons before making that decision to spend that money to get into that program. So it's really, really very important to speak to mentors. And a good place to find them is really on LinkedIn. There are a lot of persons there who are on LinkedIn. So you just search them, send them emails or send them DMs. A lot of them will usually reply and probably fix a 30 minutes, 45-minute session to sort of go through what the questions are or what your concerns are. Then you can now make a better informed decision as to where you want to go to or how you want to approach it. I remember sometimes somebody was asking what's the difference between bioinformatics and health informatics, if they're actually the same thing. And I like, no, they're not really the same thing. So that those are some of the questions that you sort of now get clarity on before you proceed. Then very just a minute. This- oh, sorry. So after, I think that this probably the most important. Well, every part is important anyway. So when you get into the program, the truth is, it's going to be overwhelming. I don't know what uni you probably end up with, but the workload is intense. It's massive, and it could be back breaking, right? So your time management, I think it's probably the best asset you need to have or you need to develop if you're going to sort of succeed in this program. because there are a lot of things to read and it looks like there is no time available. And you also sort of need to consider the fact that maybe you probably want to work your whole 20 hours a week, or you even got family at the same time, then it becomes really, really, really difficult and challenging. But if you have a good time management approach, then it's usually very helpful. So first of all, you need to have deadlines, right? So I did very well with deadlines. So again, it depends on the school. Different people have their different approaches. Like for Swansea University, it was 1 week in class, 3 weeks you go home and study and do your assignments and all of that until we finished the program. Some people is like every day or whatever, but whatever it is, you need to have you know a timeline or a deadline. So basically, like what I did was we did 1 week in school, Monday to Friday, back to back, had all your lectures. Then you had 3 weeks to sort of, you know, read through, do all your assignments. And it looks like 3 weeks is a lot of time. But before you know it, the next module is on you. So you need to clearly, say, okay, by the end of this week, this is where I should be. By the end of next week, I should have finished these assignments. By the end, so you need to establish those deadlines and actually plan on keeping them, or else you're going to struggle. Then that also sort of leads into the use of technology. So there are a lot of apps out there that could help you with, setting deadlines, helping you with, giving you reminders. You've not done what you're supposed to do, or you've not done this, or you've not updated this, and all of that. Please use all those. There are a couple of ones I use. I think there is a Note Taker. I think there's Microsoft To Do. Those are the ones I pretty use, and they work for me very well. So I use them to put deadlines and I get constant reminders to say, yes, okay, you're actually on track or you're behind schedule. Now you need to have a schedule as part, like plan of this is what you're going to really do day by day, week by week, month by month. So I find the daily approach very much more, it might look a bit cumbersome, but I think it just helps you stay on top of all the activities you need to do. So I had like a daily schedule, which led into a weekly schedule. Okay, by the end of today, I should have covered this module. By the end of this, I should have read, 15 papers or 15 journals or whatever. You need to sit down and plan that. And the good thing is, I think most of these unis, by the time you enter, you already have the work plan from the beginning to the end of the program. So it's even easy for you to plan how you're going to study. So it's not the one where every month you're waiting for somebody to send materials before you start planning. So you can actually sit down and draw out a plan for the whole of your program. So it helps to have a schedule. Then when you have a schedule, you won't be able to meet all your schedules all the time, to be fair. That's where prioritization comes in, because things are going to change. Other things are going to come in, things that will conflict here and there. So you need to be able to know how to prioritize. Which one am I moving down? Should this one come up? Which one can I defer? Which one can I eliminate totally? You have to know how to prioritize your activities, because if not, like I said, you're going to suffer greatly. Then take breaks. It's very, very important for you to take breaks occasionally. You can't be, if it's in my school, Judy will tell you that's the program manager, you read until your eyes bleed, which is actually true. But you need to be able to take breaks occasionally to refresh, do other things before you come back to what you're doing on the program. Then, in terms of study techniques, you need to start early. That's why I said you start planning early. You start early and don't cram. Why is this important? Because by the time you start working, the whole theory or everything you've learned starts to come into play, depending on where you're working. Then it makes a lot of sense, all the whole thing you've been studying. Say if you've been cramming, then it becomes a bit difficult to even remember stuff and be able to apply them effectively. So start early, don't cram, learn as much as you can, understand the concepts, first principles, and that will usually help you as you start working. Then I think I've mentioned this, have a study plan or create a study plan. So by the end of as you're starting, you should have a rough plan to say this is how I want to approach things. Then ask for help. The library is there, program director is there, your tutors are there, a lot of people are there to help you. Please ask for help. Nobody knows everything, and that's why you're in school to actually learn. So if you're confused any point in time, please ask for help. And I know people are always willing to help. I think the other day somebody sent me a DM that I should help him review his dissertation. I said, no, that's beyond me. So I'm not going to review your dissertation. Talk to the people in university. They are always there to help you. Then your learning style, you need to understand what your learning style is, because everybody does not, understand or learn the same way. So sometimes you probably see people, trooping to the library 247, and you are home and you're wondering what's going on. You need to find what works for you and stick to that plan. Like myself, I didn't read in the library a lot of the times. So I sort of found it easier to read at home, then visit the library occasionally, and that worked for me. Some people found it more conducive staying in the library 247 and taking occasional breaks, which is still fine. But you need to find what works for you and stick to that plan from day one. Then, if you're the person that thrives at reading at home, then you should have a very conducive space where you can study, nobody is disturbing you, and all of that. Then take notes, take a lot of notes, because you won't remember everything. I think I still have the notes I took from Swansea University with me up till date. So take notes, because you have to refer to them occasionally to refresh yourself, remember things, and jot things really. Then stress management plan. You should have a plan of how you want to, ease stress, because stress will come, and a lot of stress. So it could be, for those of us that are in Swansea, it could be going to the, that beach opposite the university to relax, or going to city center. Shall have something that you know to use to manage stress, because it will definitely come. Then group work, do you collaborate versus self-study? I know Swansea, they have a very strong policy against group work. So again, I'm not speaking for them, but you need to figure out what works for you. So I do a lot of self-study, then we support from library and all of that. So again, I think it's you can figure out what works for you, and make sure you're sticking to university policy. If they say no group work, please no group work. And yeah, I think with this, you should be able to fairly manage your workload effectively and be able to finish in record time. Because what happened was a lot of persons felt that there was actually a lot of time, but when it now got to close to dissertation, a lot of people were now struggling, really, really struggling to meet up. So that's for uh that one. Then there are a lot of resources out there that's going to help you. First of all, university library is there. So you need to make the best use of the university. So there are lots of journals, there are a lot of textbooks there, physical copies, and all of that. So you can use all of that to your advantage. Then you also have the online account where you get to use the online versions of this. So for people who don't like hard copies and all of that, you can access those online databases like PubMed, Scopus, Web of Science, and all of that. So you can get those ones done. Then referencing applications, you must know how to use at least one referencing application, because it will make your life very, very easy. I remember my first module, I struggled significantly because I was manually, I think referencing will probably take you like 50% of the work involved. But in module one, I was struggling because I was manually entering every single, reference one after the other. And even after that, I think I almost failed that module. But until I now found Zotero and understood how to use it, then my life was very, very easy. So you need to find one. I know the uni, I know Swansea University, every uni anyway give you access to some of the referencing tools. But Zotero works for me, and that's what I've been using even up till today. So this is very, very, very important. Then a lot of writing applications. Well, again, it's good to write on your own to sort of perfect those skills. But when it comes to things like maybe paraphrasing and all of that, then I think that's where tools like Grammarly comes in. You can decide to use the free version, or you could use the what do you call it now? Paid versions. That's on you, but it helps you paraphrase your things right properly and structure. But again, the uni also offers, I think, writing classes or something. I can't remember what they call it, academic success or something. I think other schools also do that. So that will also help you complement this. So it's up to you to find what works for you and use them. But personally, I didn't use Grammarly really. Then in terms of note taking, yes, I did a lot of note taking. Like I said, I used MS Notes. There's Evernote, there is Notion. So I combined using MS Notes and physical writing. For some reason, I still prefer to write with my hand. Probably sticks better when I use that. So in terms of resources, you have to leverage every single resource that you can get because you're paying for them. So it doesn't make sense if you don't use them. Then for dissertation, first narrative is that it's going to test your patience, your determination, and consistency. This is very true. And I mean, people who have also finished will also attest to that this is really going to test you because it's very rigorous. So you need to start thinking early what it is you want to do in terms of your dissertation. What kind of research do you want to do? Is it going to be an original study? Is it going to be a systematic review? Or is it going to be a meta-analysis? Is it quantitative? Whatever I think you need to start thinking. I'm not saying you need to make that decision probably in your first or second module. It's just to start ruminating at the back of your head what it is that you want to do. Because if, for example, you're thinking of doing an original study, like I did my study in Nigeria, so if you're going to do that, then that means you need ethical approval from Nigeria. You also need to get another one from the university. So you're battling two ethical approvals at the same time. And the one in Nigeria took me 4 months for me to get ethical approval for my study from Nigeria. And that ultimately led me having an extension. So I didn't finish when other people finished because of that delay. So it's good to put all those considerations in mind from day one. Right. Then by the time you start, I think you want to treat your dissertation like work as if you're still in school. Because I think then what happened was we finished all the modules, say go and start your dissertation and all of that. So a lot of people waited to maybe 2, 3 weeks to submission. Those said they can work under pressure and all of that. But a lot of them ended up, a good number of people failed and all of that. So you need to treat it like proper school. So all that period we're doing dissertation, I just assume I was still going to school every single day. So have your workspace, create a right reading schedule, create a writing schedule, and you stick to it. If you say you're going to be writing 50 words, 100 words every day, please, you have to stick to it. And luckily for me, I think if not for the whole approval thing, but my paper was ready at least 3 weeks to submission. So it gave me a lot of time to sort of reread, digest the whole thing again, edit before the final submission. Then by the time you have your plan, it's ready, you need to break them into chunks. So it doesn't make sense to say you're going to read 300 papers in 1 week. It's not going to work, or you're going to write 4 chapters in 1 week or 2 weeks. It's really not going to. So you need to break your plan into very smart goals. That's okay. I can be doing 15 papers per week, summarize them, pick them apart and all of that. So that sounds more realistic. Or you say you write 1 chapter in 1 week, then in 5 weeks you can do the whole So you just have to be realistic, really. Then the editing part is just to let you know there's a lot of editing that's going to be done if even when you're done with your first draft, right? A lot of back and forth because you're going to be in constant communication with your supervisor or your program director, whoever that is supervising you. So there's going to be a lot of back and forth because I know I had a lot of back and forth with my supervisor. I also having a lot of back and forth with the library guys. So I had them look at my referencing a couple of times just to make sure everything was fine. Then I think people in the academic sources or whatever, they also help me look at my grammar, the structure, and all of that. So you have to budget time for all of these reviews to make sure that the final paper you're sending in is actually very good. Then back up your work. This one I can't, overemphasize this. If it's on a flash drive, if it's on Google Drive, if it's Dropbox, find somewhere and have a backup copy of your work. Because if for any reason the school will not forgive you for not submitting on time, you say you lost something or your laptop crashed or whatever, nobody is going to listen to that. So please, you need to back up your work every step of the way that you're moving, all your reference materials, every single thing, back them up because it might be required. I think I had somebody that had issues, so she had to bring all her references, every single thing she used to do her dissertation, just to make sure to confirm that she actually did the work herself. So that's also one of the benefits of backing up your work. So please back up your work every single time of the day. And if you don't know how to, please ask for help, and people can quickly put you through how to use Google Drive or Dropbox or a flash drive or Microsoft OneDrive. That's also, I think the school will give you an account. So you could use the OneDrive account, Microsoft account to back up your stuff. So that would help. Then stay in touch with your supervisor all the way. So people leave this to chance, which is not really good. So from day one, you have to be communicating. I'm not saying you be sending email every day to your supervisor, but once in a while, send to them to say, this is where I am, this is what I've done. Can you kindly review and give me feedback and all of that? So it's just give them a sense of yes, you're actually working on your stuff, you're making progress, they're giving you feedback, and you're making those changes, because it's a collaborative effort really until you're done. So that's for dissertation. Then for post graduation, again, while you're doing all of these things, you also start need to think about what happens after you finish your program. It's not when you finish that you start looking for the jobs. You need to start looking while you're still doing your program. Like for me, interestingly, I think I got my first job around November and I was submitting my dissertation in December. So basically, I had a job waiting by the time I was done with school. So early preparation is very key because time really flies, and before you know it, you're done with your program. So you need to start doing your research very early. So, and as you're going through the program, you're looking at the modules you're doing, because the way I look at it is most of the modules you do translate to real time or real life job roles. For example, you do things around change management, you do things around knowledge management. When you search NHS jobs, you actually see roles that fit into those things. So you need to start researching early. Is this what I'm going to do? Does it look like what I would like and all of that? You need to start doing that very early. Then SWOT analysis. I highlighted this one in bold. You also need to look at your SWOT analysis, your strengths, weakness, opportunity, and strength. Basically, like Atisi mentioned earlier before we started, she wants to do data. So you need to know, is that your area? Is that you like crunching numbers and all of that? Then you might want to sit into the data analysis side of things. Or you're somebody who probably likes, sitting with people, discussing problems, finding out what the issues are. They might be leaning towards like things like business analysis, or you're somebody who sort of likes building things and all of that, then you might be looking at configuration analysts, configuration support, and all of that. Or you like just managing, making sure everything works, then you're probably looking at project management side of things. So it's good to see where your strengths lie, then start looking for roles in those areas. Then you also want to speak to your supervisor and mentors too, people who are working in the areas you think you want to get into. It makes sense to speak with them, ask them questions. What's your day to day? Is it really interesting? This thing you are doing, what's the up and down and all of that, so that you can actually make informed decisions as to what you want to do later. Then organize your CV. You don't start building or organizing your CV last minute. Start doing that early on. Even though it doesn't take a lot of time, but when you start thinking early, then it makes it easier to sort of organize this early so that your job search will be in quote smoother, even though it's not very smooth. Then you now start your application. So if you plan yourself properly, especially during your dissertation, you'll find time to also sort of put in a couple of applications as you go along the way. Because the truth is, these applications, especially if it's NHS, they're very tedious, they are very stressful. So at the end of the day, you might be able to do like one or two per week. That tells you how stressful it is because you keep on writing multiple essays for every single application. So you should have a plan for making your application. Is it one a week? Is it two a week? Is it 3 a week I'm going to be doing? That has to fit into your plan because you don't wait till you graduate before you start looking for those jobs. So it's just to put that there. I think I have a couple of videos on doing the whole application thing. I'll probably still send it later. Then also interview preps. So you probably also want to, well, this is when you probably have an interview. Still speak to people to help you, discuss the job role. Again, if you have somebody who is in that space, they're usually, I know I've helped a lot of people to sort of do interview preps if I have the time. So they can sort of, sit down, ask you the questions. So more like mock interviews, basically. So it really helps before you get into the real interview yourself. So, but that's only when you have a job offer or something. Sorry, interview invites. Then you can now start thinking about interview preparation. So the main thing is get the job done before you talk about interview preparation. Then potential job roles. So I just put a list here, but this is not exhaustive in any way. I think I also attached some other job roles to these lists that I'll share the slides after anyway, that you can look at. So you can look at becoming a healthcare data analyst, business analyst. I've mentioned the configuration analyst. There's a project manager. There's a program manager. You could become head of digital transformation. This is a very senior role. Looking at clinical safety officer, could be chief information officer, CCIO, CNIO, research analyst, data coordinator. You could be a trainer. It all depends. So the way I look at it is in the whole end-to-end chain. So for example, you're looking at a electronic record system project per se. So you're trying to implement that. So from that whole end-to-end process, there are a lot of people that are going to work on that project. So all these ones you're seeing on the screen, they are all going to work on that project in one way or the other. I've still There's still a lot of people who are missing from this list that are going to work on this thing. You have people who are looking at risk and safety. You're looking have benefits managers. You have governance people, that's data governance, looking at all those whole GDPR, data privacy, and all of that. You have people who are doing communications and engagements. That's somebody's 9 to 5 role. You have clinical governance people also working on the project. So a whole lot of roles are open here for people to consider. So it basically just depends on your interest and where you think you want to be and the skill set you have at that point in time. then you can sort of get into those roles. I think I attached another extra 17 roles down. Sorry, let me just make sure it is. Yes, so I added these ones. I won't get into the details of all these ones, but I'll share the slide so that you guys can have a look at this. So this is health informatics specialist. Then there's a clinical data analyst. Then there's telehealth. There's a project manager. There's digital health strategist. There's a clinical application specialist. There's the bioinformatics. There's the AI researcher. There is data privacy officer, software engineer, digital therapeutics developer, VR developer. There is data scientist. There is patient monitoring specialist. There is product manager. There is UX. There is also UI. There's business analyst. Then, okay, these are the ones: risk management, change management, benefits, AI, machine learning, digital adoption, cybersecurity, quality assurance, software testing. So those are some of the roles that are open to people in this space. Like I always say, it's not exhaustive. The list is almost endless. So it depends on what you're looking for. And yep, you just get it. So think that's it from me for now. If you have any questions, I'm happy to answer. Just stop sharing this one. Yep. Happy to take any questions you might have. Let me just move this back. Skip. ATC, do you have any questions? Any questions from anybody?
Thank you very much, Dr. Ron. I just wanted to ask, so for the first roles you listed,
Yep.
can you point out the roles that someone could take up without upskilling? Like with just the knowledge you gain from health informatics, from the master. Yeah,
Yep.
which of those roles can someone jump on
So,
without
so
having to
the
take
truth
any other
is,
course?
either way you look at it, you have to upskill. So let me use myself as an example. So the first job I applied for was for a data quality officer. That's DQO, they call it, data quality officer. And leaving the health informatics knowledge by the side, you're dealing with data quality. Fine. Health informatics will teach you data has to be clean, data has to be high quality, it has to be good for the use, fit for purpose, and all of that. So that's your background theoretical knowledge or understanding of what data quality should be and what it should look like. Then, but when you now get into the job as a data quality officer, one of the things you'll be doing is basically cleaning data, validating data, removing duplicates, probably running queries once or twice, really. So either way, you would need to have a good understanding of Excel, first of all, to do that role effectively. So you can't really say that you don't need to upskill in any way for you to be able to do that job effectively. Sure, you get. So
Yeah.
if you remove HI from the equation, you shall need to know
Mm-hmm.
Excel, at least basic understanding of Excel to be able to do that job effectively. Then by the time you now add your health informatics knowledge or background, then it begins to make a lot of difference because you're now seeing things that other people might not be able to see because their work is just okay, just do this, do this, do this. But because you have an extra understanding of the principles behind these things, so you probably be able to do it better or even be advising people why it should be done and all of that. So that's why sometimes I struggle with trying to dissociate, upskilling and your knowledge together because somehow they go hand in hand. And for example, to be fair, I work as a business analyst now, and so even though I didn't have any prior experience, but I will now say that the knowledge I gained from the course was really, really handy. So I now had to sort of focus on learning the technical part of business analysis. What are the tools I need to use? How do they work? What is process mapping? Learning the language and all of that. So, but for the fact I already had the theory behind me, it made that transition a lot easier. I don't know
Yeah.
if it makes sense.
Yes, it does.
Yeah.
Absolutely. Yeah. So I asked that because fresh out of school, I wish I had this knowledge when I was still in school,
Yeah.
and I wasn't on LinkedIn. It was that bad, so I didn't have access to most of this information.
Mhm.
But so I'm just reflecting, fresh out of school, what would have been the first role, like, or even like you said, apply before you graduate. So for people who might be listening,
Yep.
what can they possibly be applying for? Because for me, I had to, when I came out, I thankfully I got a job.
Yep.
But I still have to be learning. I'm still learning the tools that I
Mhm.
need for the main role I want.
Yep.
Right. So so I want, I don't know if you can categorically point out what, fresh out of health informatics, what role should I be applying for
See, to
that
be
I can qualify for, like I can meet the essential criteria with what I have, with the knowledge I have and the skills I have at the moment, before I now start thinking of learning tools or learning other things to upskill.
without thinking too much, I'll probably say things around the realms of project support officers, right? So, like a project support officer, you're just in the middle, you're supporting all the activities that are happening. It's not like you're the one doing the technical work, or you're not the one making the decisions, but you're just in the middle facilitating all of that processes. So that will probably be my first go to say, okay, this is something you can do. So project coordinator, project support officers are helpful. Then, I mean, things like data analyst, things like data coordinator, things like digital trainer, you can also apply for those ones. I mean, to be fair, because by the time you start doing your applications, you start seeing some of the extra requirements, and some of them usually be on that desirable. So it tells you that, okay, this is not really a barrier per se for me to get in, but it's something that if I have, it sort of helps me, progress further or faster in that role.
Okay.
I don't know if that helps. Yep.
Yeah, thank you very much.
Something. I think I got a couple of questions in the chat. Let me see. Somebody asked about graduate school funding. I know there are a lot of funding opportunities in the US than opposed to the UK, because I know some people who've done even up to PhD level fully funded in health informatics in the US. So if you're looking for graduate school funding, I'll probably say you should be looking towards the United States rather than the United Kingdom, really. So that's for funding. Then let me check. There's another question I got. Where is that question now? Um, Somebody asked, how can I join the NHS as a fresh graduate? So again, joining the NHS is basically a function of early preparation and do your homework, really, because those applications take time. Recruitment process in the NHS sometimes takes time. So it's you starting the early. So again, it could be, are you thinking of a graduate program, or you just want to start working immediately? So I know a couple of trusts also do this, their NHS graduate scheme something. So I think I know one or two persons who are actually doing that scheme at the moment. So I really don't know how it works. So for some people going through that process, then they basically just climb the ranks as they progress, or you just want to look for a regular job and move in. It's not as if they wouldn't pay you on the graduate program. It's usually paid, but I haven't really explored that in detail because it's not really what I look at for. You can get in as a fresh graduate either through that graduate scheme or getting a normal job and then climbing as you progress up the ladder. Then somebody asked, can they get into informatics with an optometry degree? Yes, you can get in with any degree, really. I got in with medicine. I had classmates who came in with social care background. I had people who came in with computer science background. So basically, yeah, you can. Optometry is still part of clinical or medicine, really. So you can come in with optometry degree. So I think most of the schools they're just in on your the reason why you want to study and basically your supporting statement really. So if it's strong enough, then they're happy to give you the admission. So most informatics program usually say it's either you have a computer background, an engineering background, or a healthcare background. So any of this you can actually get into the program. So and a good number of them. That's why I also mentioned about looking at the modules to see if there is a lot of coding, coding a lot of question. If the module is going to involve a lot of coding, then you now probably want to think twice. Are you ready to do a lot of coding and all of that to decide which one you want to attend? But yes, if it's optometry, you can get into a program. Esther, yes, you can unmute yourself and ask your question.
Hello, thank
Hi.
you very much for this meeting. My name is Dolapo. I'm a final year medical student and
Okay.
a freelance data analyst, and I'm very, very happy to be on this call. Even though I've not finished yet, but I'm very much interested in doing clinical research analysis after school. And I've been wondering what sort of postgraduate paths that I can follow. But I've learned a lot from this call this evening. So I wanted to ask if there are some things that I can start to put in place, maybe as a graduate, to boost my chances
Mhm.
and ensure I get what I want. I'm interested in clinical research analysis. Thank you.
Good question. Thanks for that question. So, it, clinical research on its own. So, I don't know if you want to do it from this perspective or call clinical research, because I know people work in clinical research as a field entirely. So that's where you are now talking about clinical trials, data management, clinical research analysis, and all of that. So again, depends on how you want to take it. I'll probably maybe message me later. I'll put you in touch with some colleagues who currently work in the clinical research space. So they will probably be able to explain to you further how to approach that. But the truth is, if you have very sound data analysis skills, really, I think if that's what you want to be doing or analyzing clinical research data, then if your data analysis skills is sound, I think you can fit in fine. You probably need to take a couple of certifications. I think that good clinical practice and some other things. So again, it depends on the approach you want to use to do it. And then it becomes a lot easier to navigate. So you could message me. I'll just connect to one or two persons who are in clinical research. Then you can take it up from there. Hope that helps.
Yes, thank you very much.
All right, that's fine. You're welcome. Uh, any other question? Just trying to check some of these questions I got. So some people are asking, if somebody asks, what are some of the major current and possible future challenges for early and mid-career persons in health informatics? So in terms of current challenges, so I'll probably say depending on what area you sort of want to work in the whole across the whole spectrum, one of the key things you have to remember is you have to learn the technicalities of whatever area you're getting into. So for example, if it's business analysis, then you start have to learning business analysis to process mapping and all of that. If you're looking at project management, implementation, then you start have to thinking about taking Prince 2 certification or PMP and all of that. You have to start considering all of that. And that costs a lot of money too, in terms of getting certified and all of that. Then people who are doing analysis, you want to think about, getting proficient in things like Python, R, Excel, or looking at the programming side of things. So whatever area you're looking at, then there's something for you to do in terms of progressing. Then, sorry, just a minute. Yep, so I'm back. Then, in terms of future challenges, I think what a lot of persons struggle with is career progression. So it's also good to sort of have an idea of where you're going and what your approach is going to be like in terms of career progression. What's your 3-year plan? What's your 5-year plan? What certifications do I need to do to get to that stage? So those ones are really important. Those who are ahead of you, where are they? What are they doing? And all of that. So I think a lot of persons probably just get stuck in the now without being conscious of what they want to do later. So do you want to become a program manager? Fine, if that's what you want to do. So you then need to start planning now, getting into program management. Or do you want to become maybe head of digital services or digital transformation? You need to also have that plan. So what I'm saying is a lot of people don't have that long-term plan. Just look at the now, forgetting about what they want to do later. I think I was chatting with somebody a few days ago that was telling me, she's finished, she's done this program a long time ago, but she's sort of stuck as in where do I specialize or probably niche down, which area of health informatics, is it decision support systems, is it consumer health informatics, which one am I really going to do? So a lot of people lose sight of that now, forgetting that they have to start planning for it later. So I think that's probably the future challenge I think some people might face in this space if they don't plan properly for rates. Yep. So I don't know if there's any other question. Let me check here. Can't see any other one. Then I'll probably just touch briefly about the job application process. So again, I won't say it's hard to discourage anybody, but it's the reality of things around. So that's why you need to start doing your applications early enough because it takes time and you will get a lot of unfortunately we cannot hire you, or unfortunately we cannot even interview, or unfortunately we can't shortlist you. So that's something you're going to see a lot of times. And sometimes you start questioning yourself, am I really good enough, or can I even work in this country, or can I even do this job? It's going to come. Those moments of doubt are going to come. But just tell you that yes, it's part of the process or progress, really. For my first role, I did over 400 applications before I got that role. For my second one, I did, I think, 135 before I got my second role. So that gives you a sense of, you know, the numbers of applications you have to do, the interviews and all of that, the rejections you have to get before you get to where you are. So if you see people, making noise and looks easy in the front, it's not that easy. It's difficult in the back end. It's just to mention that I'm not saying to discourage anybody, but it's just that you have an idea of what's happening in the industry. Yep. So I don't know if there's any other question anybody might have. Happy to answer. See if there's any other question I've put in here now. Let's see. Somebody asks what specialization is good in health informatics. Honestly, every specialization is good, to be fair, but I think it depends on you, your personal preferences and what you want, really. So I wouldn't say the business analyst is better than the configuration analyst, or the analyst is better than the trainer, or the trainer is better than the project manager. Whatever area you choose is really fine. I think for me, it's what gives you joy and fulfillment. Like, personally, I don't enjoy sitting down, crunching data, running queries, and all of that. So that's not my area. So it's not something I want to do every single day. Meanwhile, some people are happy, just give them Excel, and it's like you're giving them the best gift ever. So it depends on you, really. So what rocks your boat, I think it's fine. Every specialization really is fine. Some people want the flexibility of working from home, doing hybrid work options, because there are some roles that will have you on site 247. Yeah, some can give you that hybrid opportunity, some can give you that fully remote opportunity. Again, depends on what you're looking for. But just as every specialization is actually good in health informatics. Then I got a question, is funding available? Yes, funding is available in certain countries, in certain schools. So it's for you to do your research properly, find them, and then make your application. If they give you, that's fine. So that's it for that one. Let me see if there's any other one. Which country has the lowest fees for a health informatics master's program? Honestly, I don't know the answer to that question. Honestly, probably something I'll take away to go and do some research on, but I don't know. I don't know if there's any other question. What we'll call it a day. I'll still share this recording after this. Let me just check if I've seen any other question. Sulaimon, Blessing, Dolakmo, Leslie, and Kate. You can ask whatever questions you have, or you can pop them in the chat. I'm happy to read them and answer them.
Hi, Ronald.
Yep. Hi.
I'm completing now dissertation. Okay, I'm about to complete I have to submit by this September 30, as you know.
Okay.
I have started applying for few jobs, and I'm B Pharmacy graduate in India, and I have done few jobs in India, like a marketing representative, and after that, in one company, I used to deal with US health citizens denials and non-denials of this health insurance, health claims. Uh, as a revenue cycle specialist, the problem is what when I started to apply, I feel like there is problem in my resume or what it is. I have applied multiple jobs, but yet there is no response, nothing.
Mhm.
So first thing, I want to ask you for a help or like any consultation, if you can give for my resume review, that will be great. And being a pharmacy background, what would be the suitable job roles where I can hit exactly rather than just trying to swim in the sea?
Mm. Good question. We'll probably speak later, but at a high level, when you're doing your applications, from my experience, your cover letter or your supporting statements really, makes a lot of difference, really. So because that's where people sort of decide, are we going to hire you or are we not going to hire you? So if you don't take the time to, write your cover letter well or your supporting statement, then chances are that nobody might really shortlist you for any interviews or job invites, really. So that being said, again, it's also important for you to sort of look at, like I mentioned earlier, probably you joined late, in terms of your skill sets and your abilities, right? I mean, what are you good in? Are you good with Excel? Are you good with project management? What's your previous background before? What have you done in the past that sort of relates to what you want to do at the moment? Then I think it will also be helpful to get a sense of the type of jobs you've been trying to apply for, because a lot of persons do just generic job applications. Yeah, they just see the job adverts, they just make that application without actually reading in depth, line by line, what the job requires and all of that. Because some of these systems, they use this, what they even call it, the ATS, applicant tracking system, to sort of read through some of those things and just knock people out. So there are a lot of factors that actually involved in getting, an invite. Then you said, is in the US you're doing your applications, or in the UK, or where is that?
No, I'm doing only in UK. In US, like in India, I worked for a company where I was
Yeah.
working as a revenue cycle specialist, where I used to do and deal with US citizens, healthcare claim denials and
Yep.
non-denials,
Yep. Okay.
like on HIPAA regulations, Medicaid and Medicare and other things.
I'm gonna look for. I'm going to look for. There's a video I made about doing NHS applications. I'll look for that and I'll share it with you, if that's okay. So that'll probably give you a good perspective as to how you need to structure your application. So I'm just looking if I can quickly find the video now. Let's see. Okay, so yep, I think I found it. Copy and paste. We just paste it in the chats. So I just pasted the link to the chats in the chat so you can pick it up. And this other one, I think you might find it useful to copy. So I just shared the two links in the chat so you could look them up, and if you still have any further concerns, you can reach out to me and we can discuss if that's fine.
Yeah, please. I think I'm going somehow in the wrong way. Like I feel like because yeah, I'm not able to understand like where I should apply exactly, where I'm not suitable, and or else like I'm lack of skills for this job role. Like I'm feeling like just I'm trying to swim in the sea. So
Yeah,
yeah, so I think I need to hit in a better way. So
that's
apart
fine.
And freshly graduated. I have been graduated in 2022 from my pharmacy, and after that, there was a COVID time in that, and
Mhm.
so what happened is that basically I'm in the short period of time I changed around two to three jobs. I worked as a clinical SaaS programmer as an intern. I could not get in any MNC, but I worked for a startup company for a few months. Later, then I worked for, as I told you, revenue cycle specialist. Then also, my company was saying like I don't have any enough project. Then they kicked me out, like layoff. Again, I was sitting around, so I started as a marketing representative. So as I can say, like in a particular any field, I have not much experience even for a year. But yeah, I have worked for these three job roles specifically for 7 to 8 months for each one. Now pursuing health informatics, and yeah, I have not gained any enough skills because during my health informatics, being honest, TC knows that I have taken multiple helps from her. I had multiple resubmissions. Okay, because 2 3 resubmissions also I had, which I have submitted already. So I could not gain like any extra skills during my health informatics. I was completely occupied with these things. Now my course is about to finish, and yeah, and like I need to get suggestion from you, like which way at least I should start, like gaining any particular skills as for my previous work experience, which can relate with this, or I should what I should do exactly.
Okay, let me see. What you can do, let me just put my email there. Just send me a copy of your CV. Let me have a look. Then I'll let you know.
Yeah, please. And after the resume, just please guide me, like which kind of skills I should gain, or like any extra efforts which I need to put, because yeah, degree is about to finish, as you know, and here in UK.
That's fine. I think I've got some messages here. So how easy was it to excel in the health informatics program? Well, I would say it was, well, not easy, but with planning and a good structure, it's easy to, get through the program basically and worry about other things. So you only begin to struggle when you don't manage your time effectively, you're not meeting up with assignments and all of that. But if you have that covered, then I think you're fine. Then
Yeah, it was happened with me because when I came here, as you know that in our countries, very different study types, like they teach in a very different way.
absolutely.
Yeah, in the UK, it's completely different. Despite of being a pharmacist in India with a reputed university, when I came here, I started to getting failed in the modules.
Yep.
So being honest, literally, when I failed in 301, I was completely like mentally depressed. I started to keep in touch with seniors and others, and but yeah, I have got one of my senior, this Atishi. She
Yeah.
helped me in a way very nicely, and I was able to complete my all the submissions. That also within a month. I appreciate that. Really, thanks
Yeah.
to. So yeah,
Oh,
this is how
well,
my journey was there.
well done. Then there's a question of which one is better, postgraduate certificate, diploma in HI, or a master's. I'll probably say do a master's in health informatics, really. I think that's much more better than a postgraduate certificate. I'm not saying a PG cert is useless or worthless, but personal opinion, I'd rather say do a master's and leave that. Then, from an IT background, how should your personal statement or statement of purpose to be structured to secure a scholarship in HI? Well, to be fair, I've not really looked for scholarships per se, so I wouldn't be in the best position to answer the how your SOP or support statement should be if you're looking for a scholarship. But I mean, in terms of scholarships, I'm not sure they'll be looking at if where your background is in terms of technical skills or ability. Well, I honestly don't know. And sadly, I think one of the persons I invited to come, she couldn't make it. She's not feeling fine because she had some scholarship. So she would have been better suited to answer that question. But I'll probably just send it back to her. If there is any answer there, I'll share with you guys. So yeah, I've never done scholarship, so I really can't tell how you should write your supporting statements to be able to get a scholarship in health informatics. I hope that helps. I think that's from Leslie. Yep. So let me check if there's any other one. Just a minute. This other screen.
Hello, Ronald.
Yes, please.
Yeah, one last question. During my class also, our one Scottish faculty is there and all. So,
Mhm.
how worth it is to get started with PMP or Prince 2 or Scrum Master certification at initial level, as you know that we are going to be freshly graduate in the market.
Mhm.
How worth it? Shall we start now? At least like in our Coursera, Udemy, or like even in LinkedIn also. At least there are some certifications like preparation for PMP, preparation for Prince 2, or like one site is there as you can see, Knowledge Academy. They are also giving Prince 2 certification and all.
Yeah.
So is that worth it to go ahead with that part at initial level?
So honestly, I would say if you can get a Prince 2 foundation for a starters,
Mm-hmm.
it would be great because the trend I'm seeing now is so initially like when I started working, so like the Prince 2 foundation was usually a desirable criteria, meaning if you didn't have it, that's fine. We can still shortlist you for the job and all of that. But now a lot of people are beginning to put Prince 2 foundation as an essential criteria, right? So,
Mm-hmm.
I mean, if you can, getting a Prince 2 foundation really helps. So, I didn't have to get a Prince 2 foundation before I got my role. But now I've actually registered and I'm planning to write my Prince 2 foundation, a couple of months down the line. So, if you can do that now, that's fine. If you still can't do it, that is still fine because for the UK, I think they're much more interested in your ability to deliver on the job rather than the amount of certifications you have in your portfolio. Because it's a different ball game. Yes, you have all the certifications and you start the job and you can't deliver on the job, then that's where the problem is. But if you can do the job and you can get the certification later, that's fine, really. So that
Okay.
you also have to look at the cost implications too, because I know for Prince 2 foundation is about, I think, 400, 450 pounds. Uh,
Mm-hmm.
Prince 2 practitioner is about 700, 800 pounds, if I'm correct. So you just try to balance all that stuff. And again, if you're looking at entry level roles like maybe data quality officer, project support officer, there's no immediate need for you to have those certifications per se. So it's just for you to weigh, the pros and cons. And I think somebody just, Atisi mentioned that there is a free Prince 2 training for people in Wales that starts this September. I think it's probably something you can look into and just get that one. If it's free, then you can get it.
Yep, I'll get in touch with her.
So
Yeah. Okay.
let's see if there's any other question. Let me check. Oh. So somebody asked, no, okay, I think I've seen that one before. Yep. Okay, so I think that's pretty much it in terms of questions? I don't have any other questions. If there are no other questions, I guess we can call it a day. I'll still send the recording of this and the slide deck as I promised to everybody. So you can just look at it in your spare time. Let me see. All right. Thank you, Blessing. Let me check. I'm not missing out anything. Yeah. No, I think I've got everything covered. So thanks everybody that made our time to attend. So once the recording is ready, I'll still send it back for those who want to sort of rewatch it, and I'll send the slide deck as promised. So hopefully you guys find it useful. All right. Thanks everybody.
All right, thank you very much, sir.
All right.
Thank you.
Good night.
Thanks.
Yeah.
Good night. Ronald, I'll share you my resume, please. I
Yeah,
will
that's fine. That's fine.
connect with you.
All right.
All right. Thank you.